Hi everyone, welcome to the last theory of our course. This is family system theory or so-called family systems therapy. We will go with it today and then we will finish our topics. You already know about it. To start with, the founder of family systems theory, he is Murray Bowen and he has been trained as a psychiatrist and originally practiced within the psychoanalytic model. You already know about psychoanalytic approach, and you can see his work in several centers. And actually, between the years 1959 and 1962, rather than developing a theory about pathology, he focused on what he saw as the common patterns of all human emotional systems. And he firstly published his first presentation of his developing ideas in 1966, and he focused on extended family and how he used the concepts to guide his intervention in a minor emotional crisis in this extended family. And he encouraged students to work on his theory. From his trainees came the current leaders of Bovenian therapy. Okay, to go on with family systems theory. It's a theory of human behavior that views family as an emotional unit and uses systems thinking to describe interactions in the unit. And it's the nature of the family that its members are intensely connected emotionally, and they Bovenian therapy focuses on the point that a change in one person's functioning is predictably followed by reciprocal changes in the functioning of others. Actually, you will see this in therapeutic interventions. Maybe you will do in the future. When a client comes to our sessions, we tell them that they are willing for changing themselves. We accept this. And we want to highlight the point that in case they change, their system will not remain the same. Okay? Belki daha önceden söyledim size, belki tekrarı olabilir. Arkadaşlar, bir kişi terapiye başvurdu ve direnç göstermeden değişiklik için adım atıyorsa, artık o kişinin ne içinde bulunduğu partner ilişkisine, kardeş ilişkisine, anne baba ilişkisine, eş ilişkisi, yaşamıyla, kendiyle ilişkisi artık aynı kalamaz. Haliyle ne demek bu? Kişi değişirse sistem değişir. O yüzden belki çift terapisiyle ilgili herhangi bir şeyden konuşurken belki söyledim size, bilmiyorum, bir örnek verirken. Gelen danışanda mesela mutlaka ben şey yaparım. Ailesiyle yaşıyorsa, kız arkadaşı, erkek arkadaşı, partneri varsa, evliyse, işte iş arkadaşları varsa vesaire. Derim ki belirli 5-6 seans geçince mesela, yani değişim görmeye başladıktan sonra dışarı arkadaşlarınız, işte ilişkide olduğunuz kişiler ne yapıyor? Size hiç böyle bir geri bildirim veriyorlar mı? Hani nasıl? Onların sizde fark ettikleri şeyler oluyor mu? Gibi ufak tefek dışarıyla olan ya da dışarıdan gelen tepkileri ölçmeye çalışıyorum. Neden? Çünkü bir kişinin değişimi her zaman herkesi mutlu edecek diye bir kaidemiz yok. Başkalarını sinirlendirebilir, hayal kırıklığına uğratabilir. Çünkü değişen kişi yaşamında aldığı rollerin aynılarını artık devam ettirmiyor olacak, değil mi? Hani değiştiriyor olacak bir noktadan sonra. Ve bu bazen hani bazı kişilerin işine de gelmeyebilir. Değil mi? O ilişkiler içerisinde diyelim ki bir kişi sürekli çok veren, hep karşısındakine bir şeyler sunan bir kişidir. Değişmeye başlayıp bu sunduğu şeyleri keserse, aile sistemini özellikle düşündüğümüzde aile üyelerinden tepki alır. Haliyle hep dışarıdan gelen geri bildirimleri de böyle bir arada ufacık yoklamak lazım. Çünkü bundan önce galiba bunun örneğini dediğim gibi verdim. Böyle bir makas gibi düşünün. Danışanınız bu uçta değişmeye başladıkça uzaklaşıyor ama bu makasın diğer ucu burada. Haliyle ne oluyor? Makas açılıyor. Makas açıldığında ilişkide mesafeler oluşmaya başlıyor, sınırlar gelmeye başlıyor. O yüzden oraları tutup oraları danışanımıza hazırlıyoruz. Haliyle burada dediği gibi a change in one person's functioning is predictably followed by reciprocal changes in the functioning of others. So nothing stays the same. Okay? Okay. Family systems theory does not focus on symptom reduction, but improving the intergenerational transmission process. I will give again examples for this. And there is the focus of improvement in overall functioning, and this improvement in overall functioning of our clients will ultimately reduce the family members' symptomatology. I don't know if it's difficult for you to follow these guidelines or to um, elaborate on these, but I will give examples after I briefly go over the presentation, okay? And throughout to the end of the presentation, there are some examples given session by session. And afterwards, I will provide you some examples from out of my experiences, okay? Okay. According to family systems therapy, a key generator of anxiety in families is the perception of either too much closeness or too great a distance in a relationship. So this therapy says that there is chronic anxiety actually in the family systems. And actually this anxiety in families can be either in a form of being too much close, like being dependent on each other, or having some distance, some boundaries in the relationship between family members, okay? And when the anxiety is low, we are able to think about our situations and our very existence. But as long as the anxiety increases, we become less able to think and more emotionally reactive to our situation. This means that if we don't need to be anxious about the closeness or distance in a relationship in the family, then we can focus on ourselves, okay, on our own existence. But otherwise, if we are dependent on each other in a family system, or either otherwise if we are not able to form any relationship with each other, then this means that we will not be able to concentrate on ourselves but the family relations indeed, okay? Um, Şimdi arkadaşlar ileride de göreceksiniz koalisyonlardan bahsedeceğiz. Bir aile sistemi içerisinde eğer anne, baba, çocuk, kardeşler vesaire belki geniş aile üyeleri çocuk büyürken neye maruz kalıyor? Bir kaygıya. Bu kaygı çerçevesinde ya anne baba inanılmaz birbirine bağımlı ve kaygılılar ve birbirlerine bir şey olacak, çocuklarına bir şey olacak diye inanılmaz endişeliler ve korumacı tavır içerisindeler. Ya da inanılmaz şekilde çocuk büyürken tanık olduğu şey anne babasının ya da aile içindeki ilişkilerin ne kadar birbirinden uzak olduğu üzerine oluyor. Şimdi böyle bir ortamda büyüyen çocuk, belki kendinizi de düşünebilirsiniz bu noktada, ne yapacağını şaşırır. Hangi ilişki düzleminde kendini kurgulayacak? Şimdi bütün bir şekilde aile içi ilişkileri üzerine odaklanan çocuk nasıl dikkatini kendine döndürsün, değil mi? Nasıl kendi hayatına yönelsin, kendi varoluşuyla nasıl ilişki kursun? Haliyle aile içinde kaygı yaratan ilişkisel dinamikleri çalışıyor Family Systems Theory. Daha detaylandıracağız. Considering that there is a chronic anxiety in the family, differentiation, one of the key concepts of family systems theory, states that how one functions in response to one's level of anxiety is important, they say. Okay? And capacity of an individual to function autonomously by making self-directed choices while remaining emotionally connected connected to a significant relationship system is very difficult, but this means differentiation. And the more differentiated a self, the more a person can be individual while in emotional contact with the group. Arkadaşlar bu ayrışma dediğimiz şey. Ayrışma, bunun sonrasında da bireyselleşme geliyor sistemlerde. Şöyle ki biz büyürken bir şekilde özellikle çocukluk dönemimizde ailemizle yapışık ilişkiler kurarız ve onların değerlerini alır, onların değerlerini benimseriz. Ergenlik itibariyle aslında bu ayrışma oluşmaya başlar. Çocuk ergenlik dönemine kadar biz bilincindedir. Biz bilinci ne demek? Annem, babam, kardeşim ben yani sistem. Ait olmayı tercih edip güvende hissettiğimiz sistem. Bizlik içerisinde çocuğun temel motivasyonu ait olmak, sevilmek, güvende hissetmektir. Tamam mı? Ve bunun içinde ne gerekiyorsa çocuk da yapar. Tabii ki bilinçaltı düzlemde. Hatırlayın bu kuram da sonuçta psikanalitik kuramdan temelini alıyor bir parça da olsa. Şimdi haliyle sistem içerisinde çocuk ne kadar ayrışabildiğini ergenlik döneminde hissettirmeye başlar. Bu zamana kadar dediğim gibi aile içerisinde ne tür bir boşluk varsa, çözülemeyen ne sorun varsa çocuk sistemin devamı ve aidiyetinin devamı için o sistemde kalmaya devam edebilmek için gerekiyorsa kendinden vazgeçer ama ortadaki sorunu bilinçaltı düzlemde yüklenir ve ben bunun çözücüsü olayım der. Böyle olunca ne oluyor? Anne babasıyla mesela ilişkisinin yolunda gitmediğini gören çocuk onların aralarındaki ilişkideki düzenleyici olmaya, problem çözücü olmaya başlıyor. Çünkü sistemin dağılmasını istemiyor. Ama ne zaman ki çocuk bu sistemsel olarak oluşan kaygıyla başa çıkabilmek adına ve hani bu kaygının bir parçası olmamak adına kendi kapasitesiyle davranmaya başlarsa ki bunun ilk adımı ergenlik. Ergenliğe biz ben bilinci diyoruz. Ne demek o? Ben bu zamana kadar aile sistemin içindeki bütün değerleri aldım, normları öğrendim, kuralları, gelenekleri öğrendim. Bunları cebime koydum. Şimdi ama dışarıda bu aile sistemimden daha başka bir hayat var. Hadi ben o zaman biraz oraya çıkıp orayı keşfetmek istiyorum diyebiliyorsa çocuk. Bunu diyebilmek için de tabii ki biraz agresyon gösterebilmeli ve hayır diyebilmeli, değil mi? Sürekli itaatkar ve uyumlu olursa kalkıp dışarıyı keşfedebilir mi? Keşfedemez. Bir parça agresyona ihtiyacımız var. Bunları yapabilirse çocuk, dış dünyayı keşfe çıkabilirse, bu dünya içerisinde hatalar yapıp düşüp tekrar kalkıp bunlardan bir şeyler öğrenebilirse bene doğru bir yolculuğa çıkmış oluyor. Ve bu yolculuk anne baba tarafından, anne baba kaygısı, aile kaygısı tarafından sabote edilmezse eğer çocuk ayrışmaya sonra da bireyselleşmeye başlıyor. Aslında differentiation dediğimiz şey tam da bu. And the other concept that is frequently used in family systems approach is emotional fusion. This is tendency for family members to share an emotional response as a result of poor interpersonal boundaries. An undifferentiated person has only emotional or only intellectual responses to anxiety-producing situations, and this approach involves helping the client understand the difference between and value of both emotions and thoughts. Okay, in family systems therapy, we focus on how our clients will deal with these anxiety producing situations in the family systems. So we encourage them not to be part of the interpersonal boundaries or not to get intervened in the relationship, but to stay at a balance and to explicitly express their both thoughts and emotions. Okay, and we have this triangles concept. Triangling is said to occur when inevitable anxiety in a diet, is relieved by involving a vulnerable third party who either takes sides or provides a detour for the anxiety. Şimdi arkadaşlar, üçgenleşme ya da koalisyon diyoruz buna. Şimdi biraz önce çocuğun hikayesini anlattım ya, çocuk büyürken bir boşluğu görecek haliyle. Nerede sorun var? Mesela hiç sorun çözemeyen bir aile sisteminde gidip en iyi sorun çözücü olacak. Bakın bakalım sizin PDR bölümünü seçmenizde problem çözemeyen aile sisteminden gelmenizle ilişkili bir durum var mı acaba? Hani altta yatan öyle bir motivasyon var mı acaba? Şimdi çocuk büyürken ister istemez aile içerisindeki sorunlar da böyle dışarıdan bakıyor. Kafasında da tabii ki sistemi devam ettirme fikri var ya. Aynı zamanda da çocuk büyüyor yalnız ama kendine dayanak istiyor. Dayanak ya anneden geliyor ya babadan. Ve çocuk büyürken anne ya da babayla ilgili kodlamalar içerisine giriyor. İşte annem zayıf ya da babam çok zayıf. İşte babam duygularını kontrol edemiyor. Annem daha güçlü. Tam tersi vesaire. Çocuk haliyle küçükken belirli bir gücün peşinde değil mi? Ee, Dayanak istiyor çünkü düştüğünde onu kaldırabilecek birini istediğine göre. Şimdi bu doğrultuda ne yapıyor? Ebeveynlerinden biriyle koalisyona giriyor fark etmeden. Bunlar hep bilinçaltı düzlemde oluyor. Yani ne demek koalisyona girmek? Birinin tarafını tutmak demek. Birinin tarafını tuttuğum zaman üçgen oluşuyor. Tamam mı? Normalde altta bu anne, bu baba olmalı. Şu yukarıdaki de ben olmalıyım. Yani aslında bu ilişki düzleminin dışında olmalıyım. Ama sonra bir bakıyoruz, üçgen hop dönüveriyor. Alt tabanda annem ya da ben aynı düzlem ilişki kurmuşken üçüncü diyelim ki babamı dışlamaya başlıyoruz. Tamam? Daha çok öfke seviyesi yüksek olan şiddet gösteren babalarda baba sistem dışında bırakılır. Ya da kız çocuğu bazen babasına kıyamaz, babasıyla koalisyona girer, annesini zayıf görüp annesini sistem dışında bırakır. Böyle iç koalisyon ve üçgenleşmelere diyoruz bunu. Böyle bir düzlemde çocuk ayrışabilir mi? Mümkün değil. Girdi oradaki çift ilişkisinin ortasına, kaynaştı. Oradan çıkmak çok zor. Okay, and to go on with nuclear family emotional system. This is the total degree to which emotional fusion can occur in a family system. Okay, and relationship fusion, triangling, and clinical dysfunction are the parts for this. And there are three categories of clinical dysfunction in families. First of all, them is couple conflict, maybe as I mentioned before, dysfunction in a spouse and dysfunction in a child. So let's start with family projection process. It describes how children develop symptoms when they get caught up in the previous generation's anxiety about relationships. And child with least emotional separation from his or her parents is said to be the most vulnerable to developing symptoms. And family projection occurs when a child anxiously responds to the tension in parents' relationship. Aslında biraz önce bahsettiğim örnekteki gibi çocuk aile sisteminin tam da ortasında olunca çift ilişkisinin, anne babasının çift ilişkisinin de ortasına düşüyor. İkinci ve üçüncü noktada olanlar bu. Şimdi çocuk o çift ilişkisinin ortasına düşüp anne ya da babadan biriyle koalisyona girdiği zaman kendine yönelemiyor değil mi artık? Çünkü ayrışma, bireyselleşmenin gelmesi çok zor. Ayrıca terapi destek falan alması lazım ya da çok büyük bir farkındalık yaşaması lazım. Haliyle bu sisteme düşen çocuk semptom üretmeye başlar. İşte döküntüleri olur, sürekli hasta olur, vücudunda sürekli inflamasyon, enfeksiyon olur, iltihap olur. Çok ileri safhalarda kanser olabilir. Yani beden semptom üretir. Tamam mı? Sürekli baş ağrısı olur vesaire. Şimdi ilk kısım arkadaşlar şu. Family System Therapy diyor ki Biz en az 4 jenerasyon öncemizden gelen yaşantı ve deneyimlerin etkisi altındayızdır diyor. Bunlar bir savaş olabilir, ondan sonra miras kaybı, ondan sonra tecavüz, taciz, sistemde tekrar eden hastalıklar, ölüm sebeplerine bakarız genelde. Acaba evlatlık verilen var mı bu 4 jenerasyonda? Göç var mı? Am, travmatik deneyimler, travmatik deneyimler var mı? Bunlar aslında bayağı önem kazanır. And there is another important key concept which is emotional cutoff. Um, this is the way people manage the intensity of fusion between the generations. And it can be achieved through physical distance or through forms of emotional withdrawal. And in this part, these are complex terms, so I'm trying to ease the way to describe you to understand better. If we unconsciously carry the impacts of traumas or any experiences of loss coming from our previous generations, then we will have an anxiety which we don't know the reason of. Okay? So, in order to be able to cope with it, we will either have put some physical distance to our relationships with our families, or we may withdraw our emotions. We see that most of the people who are not able to handle this anxiety are eager to really physically go to a very far away country. But of course, unless you resolve this anxiety, then it will come with you wherever you go. Okay? And multi-generational transmission. These are the patterns, themes, and roles in a triangle, and they are passed down from generation to generation through the projection of parent to child. And in this approach, sibling position, as it was in Adler's approach, is important. They state that family systems theory defenders state that sibling position is a factor in determining personality, where a person is in birth order has an influence on how he or she relates to her parents, his or her parents and siblings. For the eldest children, they are more likely to take on responsibility and leadership. Younger siblings are more comfortable being dependent and allowing others to make decisions. And middle children have more flexibility to shift between responsibility and dependence. And if you are the only child, responsibility and having greater access to the adult world is easier. Okay, and let's see how this family systems theory works in practice, okay? The goal of this therapy is to assist family members toward greater levels of differentiation, where there is less blaming, decreased reactivity, and increased responsibility for self. And the hallmarks of this therapy are anxiety reduction and insight to family dynamics. And the role of the therapist is to maintain a differentiated stance, to connect with the family without being emotionally reactive. The therapist should be calm and interested. And the therapist has the role to get the family into position to accept responsibility for changing. Okay, a therapist is active in directing the clients. Clients are asked to talk directly to the therapist so that the other family members can listen and really hear without reacting. Enactments are halted so as to prevent the escalation of the client's anxiety. And We avoid asking for emotional responses. We ask for thoughts, reactions, and impressions. And in Bowen's therapy, children's involvement is minimum, um, and they are viewed as a D-triangular maneuver. And genogram is an important point to consider. In the initial sessions, we focus on information gathering in order to form ideas about the family's emotional processes. And the genogram is a pictorial representation of family structure along with specific information such as dates of birth, deaths, and marriage, as well as descriptions of relationship. Arkadaşlar bu benim Family Systems Theory, özellikle benim aile ve sistem dizimleri terapisinde sıklıkla kullandığım yöntemlerden. Ve genogram, diğer ismiyle de soy ağacı da böyle sıklıkla kullandığımız bir yöntem. Bireysel terapide de grup terapisinde de kullanabilirsiniz, yararlanabilirsiniz jenogramlardan. Kişinin en az 4 jenerasyona kadar edinebildiği kadar bilgi edinmesini istiyoruz. Kişi burada olduğunu düşünün. Onun sisteminde kimler var? Kardeşler. Bir doğru üzerinde şimdi şekillerini göreceksiniz. Kardeşlerinin bilgileri evli mi, değil mi, evlilik için, kadın erkek olmak için, ilişkinin devam edip etmemesi, arada düşük, kürtaj olması sistemde, boşanma, işte ölen birilerinin olması için semboller kullanılıyor jenogramda. Önce kendi sistemimizden başlıyoruz. Ben ve aile sistemi. Diyelim işte benim 7 yaş büyük ablam var. Onu yazıyorum. Evli. 2 tane çocuğu var. Okullarda onu gösteriyorum. Ben varım. İşte eşim var. Erkek kardeşim var. Eşi var. Hepsini yazıyoruz. Hepimizin bağlı olduğu sistem ne? Annemizle babamızın sistemi. Ama annemin kendi içinde anne babası, babamın kendi içinde anne babası. Onların öyle her böyle çatallanan her kişinin sistemini ayrı ayrı yazıyoruz. Tamam mı jenogramda? Daha doğrusu danışanımızın bu bilgileri edinip getirmesini istiyoruz. Sonra biz seansta tıkır tıkır tıkır bunları çizerek yapıyoruz. Bunlara hakim oluyoruz bir şekilde. You see gender symbols here. For male, we use this symbol. For female, this one. If they are deceased, we cross them. But general symbols for gender, pet, and unknown gender are as this. You can see the child links and special births, biological child, adopted child, foster child, pregnancy, miscarriage, abortion, male stillbirth, female stillbirth, okay? These are the symbols. And for multiple births, we use these symbols. You can check them in detail later, okay? And for family relationship, if there is marriage, we draw this line. If there is divorce, we have this without separation, in fact, legal separation, legal cohabitation, etc. These are the symbols. And dating, rape. You can check these, okay? We write the time the relationship started or how long they have been lasting for. For interpersonal relationships, we have these symbols, but of course here, as you see, we are always, and in these examples there are these opposite sex relationships. It may be male to male, female to female as well. Then you will change your circles and squares, okay? These are the other symbols. If there is mental or physical problem in any member of the family in these at least 4 generations, we note these with these symbols, okay? You can examine these. Okay. To go on with genogram, therapist looks for patterns of regulating closeness and distance, how anxiety is dealt with in the system, what triangles get activated, the degree of adaptability to changes and stressful events, and any sign of emotional cutoff in the family system. Since one of the basic aims of family systems theory is to foster differentiation in the system, therapists ask questions that assume that the adult client can be responsible for his or her reactiveness to the other, and family members are encouraged to take an I position where they speak about how they view the problem without attacking or defending against another family member. And clients are taught to make personal statements about their thoughts and feelings in order to facilitate a greater sense of responsibility. And we also aim to create a multi-generational lens to look towards our past. Açıkçası arkadaşlar seanslarda ve grup çalışmalarımda ben genel olarak şey derim. Ne kadar başınıza gelenlersiniz, ne kadar seçimlerinizsiniz bu hayatta. Başımıza gelenler işte bu Family Systems teoriye göre bu en az 4 jenerasyon arkadan gelip görülmeyen ya da bir şekilde etkisini diğer jenerasyondaki çocuğa yansıtan o dinamikler. O yüzden öyle bir müdahale içinde olmalısınız ki bu multi jenerasyonlar arasından bize kalkıp da gelip etkileyen her ne varsa ona bakabilecek bir bakış açısı geliştirmeye çalışıyoruz bu terapi yaklaşımında aslında. And we follow patterns of relating in the past and we are trying to figure out how they continue in the present family system. And therapist uses questions to encourage clients to think about the connection between their present problem and the ways previous generations have dealt with similar relationship issues. And we are after detriangling, of course, and this is a central technique in Bovanian therapy. Client is firstly helped to recognize both the subtle and the more obvious ways that they are triangled by others. The roles they take in the coalition with their parents. And therapist uses questions that facilitate the family members' awareness of their roles in triangles. So these questions are in the form of simple open-ended questions. Once triangles have been identified, family members are helped to plan ways of communicating a neutral position to others, leaving the dyad to communicate directly with each other. And here the goal is to foster a family member to find a less reactive position in the face of others' anxiety. So there is this form of coaching in family systems therapy, and when we refer this is family therapy with an individual giving input and support for adult clients who are attempting to develop greater differentiation in their families. They utilize from coaching in this system, and clients should feel in charge of their change efforts, and emphasis is, as we mentioned before, on the self-directed efforts to detriangle from family of origin pattern. And clients practice controlling their emotional reactivity in their family and report their struggles and progress in following sessions. Changes viewed as once taking a new position, family members' reactions, and the new stances maintained in the face of pressure to revert to the original position. Now we will go through a sample case. We will see this case, George's anxiety, session by session. I will just read them, okay? And if you have any questions, you can write in the forum or ask privately, or you can take an appointment, okay? Because these are important, especially if you're interested in family systems theory. I would be more than happy to discuss and to talk this with you and its implications. Okay, George, a 42-year-old Caucasian male, is referred by his psychiatrist for psychotherapy around his depression and anxiety. George is a bright an articulate doctorate level manager in a grant funded educational foundation, and he has been depressed for 2 years and relates the onset of his depression to being promoted. According to George, he is happy and secure in his marriage. He has been married for 12 years and he has two daughters at aged at 5 and 9, and he reports that the children are doing well. However, he had difficulty maintaining the boundary between work and home. Okay, this is our case. Let's go through the session 1. Okay, in session 1, it was focused on developing a therapeutic relationship and assessing the client's situation. George reports that there is no history of anxiety disorder in his family. He describes his mother as an unhappy person. He further reports that at some point when he was a teen, his father started to withdraw to his workshop in the garage, and George became closer to his mother. He has two younger brothers, aged 34 and 32, and all are doing well, all have graduated from college, and they are in stable relationships. And in the session 1, still we go on, therapist begins a therapeutic relationship with George, and George has been started a course of antidepressant medication and benzodiazepine when his anxiety gets out of control, and he reports another depressive episode when he first moved out of the house during his junior year in college. We got the initial information about George in session 1. And in session 2, session is spent on developing a genogram. Okay, and there are some significant patterns which I emerged while doing this genogram. George feels that his father withdrew from the family when he became a teenager. At a young age, he had the feeling that his father was avoiding his mother. He felt that he was elected to serve as his mother's companion when his father became less involved, and he reported that he spent the first 2 years of his college career at a local community college because his mother was not ready for him to move out. Dun, dun, dun, dun. Try to get out, try to catch the triangles, okay? And the anxiety at the family system unit. And differentiation, okay? Try to catch the points. And when George was asked about his current relationship with his mother, he reports that at times it's strained. When he calls his parents, his mother always adds helpful advice. And whenever he calls his parents, he talks to both of them at the same time on the phone. And Klein at this point is engaged in the discussion on the nature of emotional triangles, and he was encouraged to write letters to each of his parents, okay, in the session 2. And this is a genogram. George is here, as you see, and Joey and Andrew are his brothers, okay? And Joan is George's wife. They have Janie and Olivia, two children together in their marriage. And when you see Martin's father is George's father is Martin at his 66 years of age, and his mother is Betty, 62, and they have been married since 1964, and Martin has been born at 1942 and Betty in 1946. Okay, we have the similar information for George's mother's family as well. Okay, it was the genogram. Okay, at basic level, we didn't have any information about any traumatic system or intergenerational reflections yet. This is just the nuclear family system at the point. Okay, and to go on with the session 3, actually George reported a significant decrease in his anxiety when he came to the session 3, and he has been able to stay out of employee conflict at work. And there were some self-soothing skills the therapist had taught, and he was able to talk to himself with a supportive voice. And when asked whose critical voice he heard before he said it was his mother's. Okay, George um, was very ambitious at work and actually didn't like what he was doing. He was criticizing himself. And in the therapy session, he explored the point that actually that criticizing sound was not his own, but his mother's. What does that mean? This means that George has not been able to differentiate from his mother, right? And his mother's feelings as well. He carries the same feelings and emotions with his mother. So that we are not able to talk about any differentiation here. Okay. And he went on exploring his relationship with his parents. And as a result of this exploration, he noted that his father still continues to withdraw as a response to mother's depression. So George is unable to express his anger despite looking angry. He states that he probably is, but is unable to own this feeling. And to go on, he relates how, when he was teen, his parents were unable to accept the negative feelings from him. They would interpret it as being ungrateful. See, he is still carrying um, the messages conveyed to him by his parents in his childhood, even though now he is an adult and he has set up his own marriage and family. There isn't any differentiation still. And therapist discusses setting boundaries with his parents, especially to his mother and her constant giving of advice. And therapist asks if he feels such a move is an expression of his lack of gratitude toward his parents, and George affirms this. Okay, and therapist asks George if he could write and send a separate letter to each of his parents expressing gratitude toward them. Then in the future, a second letter to each of them attempting to set some boundaries. Okay, now we came to session 4. George arrives with the letters. He is visually brighter. He reports that he has been significantly less depressed. He describes how difficult it was to write them, states how he let his emotions flow. He reports that as he wrote the letters, he felt anxiety diminish. Letter to his father discusses his dad's abandonment and his loss over not being closer to him, and ends with an open invitation to talk in person. Letter to his mother is considerably longer. He discusses feelings of inadequacy that resulted from his mother's advice giving. See, differentiation started. How can differentiation start? By firstly exploring what we really feel and to express it, and then by taking action. It's great. Okay. And session 4, therapist asks how his parents would respond. George becomes fearful, afraid that he may lose his relationship with his parents. And therapy states that in a healthy relationship, you can say what is needed to say to another person anytime. Okay, session 5. George talked about the conflict he and his wife had over expenses related to renovations. He relates to conflict to miscommunication, and therapist asks him to reflect on his feelings during the argument and relates that he was feeling abandoned and unappreciated. He withdrew from her for a number of days and felt a slight increase in anxiety and depression. See the reflection of George's rooted family into the nuclear family he just established. Okay, how we reflected um, to our other relationships, the things that we have got in our root family. And therapist asks how he pulled out of his depressed mood. He reports that it was his medicine and his ability to calm himself with positive self-talk. Okay. And rather than dwelling on the negative hurt feelings, he decided to take responsibility for his feelings and try to find way out. George büyüyor gördüğünüz gibi. Değil mi? Değişiklikler kendi hayatının duygularının ne hissedip ne yaşadığının sorumluluğunu almaya başladı. Buna büyüme denir. Okay, let's go on with session 5. George had insight that he was experiencing the same kind of feelings he had in his adolescence when his mother would criticize him. He had a productive conversation with his wife. They were able to take responsibility for their own emotional reactivity. And therapist gave a positive feedback. And at the end of the session, George discloses that he has decided to talk about his relationship with his mother in person. Dun dun dun dun. Okay, session 6. George reports he has not felt at all depressed or anxious between sessions. He attributes this to his newfound ability not to be drawn into conflict at work. He doesn't need the immediate approval of his staff to feel good about himself. He has been able to relate to his wife on a deeper level. We love you, George. Okay, as a result, he reports having a better relationship with his daughters. Of course, it's inevitable. And he spends the last half of the session preparing for his talk with his mother. He is becoming very brave, and he has decided to approach his mother from a position of love. He states that his goal is to have a closer relationship with her. Nice. And session 7. George arrives for this session in good spirits and discusses the reunion. He states that it went better than he could have imagined. George and his mother agreed that they wanted to be closer, and his mother agreed not to criticize him. Try not to criticize him. If she fell into the old pattern, George was to confront her. Good deal. And therapist mostly listens and at a few points gives some positive feedback to support the change. And George reports that he's feeling no depressive or anxiety. He's not displaying any depression or anxiety symptoms. And he talks about stopping medication. Woohoo! And he is grateful for the coaching he has received in therapy. This is not coachluk in Turkey. This is like guiding, okay? Accompanying the client. And the course of the therapy was reviewed. And George is also offered with the option of returning for a session sooner than 4 weeks, should he feel the need. And therapists say goodbye, and George thanks the therapist for helping. Happy end. Okay, this was our last lesson. It was great to be with you whole semester, and I will miss you all. I wish I could have seen you, but at the end of this semester, I'm leaving ODTÜ KKK and moving to Ankara, and I will start at another university, and I'm very excited about it. I hope I will see you later somewhere. Maybe you will come and visit me. I don't know, or we will meet somewhere. Love you all. Take care a lot. And be fine. Be good. I'll miss you. Bye bye.